Hello, this is Tikva from Homeopathy for Humanity with Sanjay from Homeopathy for Humanity. Thank you for joining us
Hello.
today.
Hello,
Hello.
and we will have introduction of our two guests also.
Hi, I am Dr. Gunjan.
And Sandhya,
Hi, I'm Dr. Sandhya Sahu from Bhopal.
okay. So today we are with the topic. It is a little bit what you call off road or off board, you can say. It is about the people's thought that homeopathy is very slow. It's not about homeopath. It's about the general public. Why people think that homeopathy is slow? What is the reason behind? Why people think that homeopathy is slow, and that's why they will prefer to go to other methods like modern medicine? Only because it is slow. Sandhya, what do you think?
According to my view, I don't think homeopathy is a slow working. Uh, I'm always thinking allopathy do the slow working because their process is a long. Our
No,
priority
no,
is the
no,
work
no.
on.
No, but many homeopaths have faced this. People are saying homeopathy is slow and it will take time. We know but we want fast results, and that's why they go to other medicine. Gunjan, have you heard people saying that
Yes,
homeopathy
heard
takes too
so many
long?
times.
Why we have such image? You can turn on your audio, Gunjan. Audio. Turn on your audio. It's muted. Gunjan.
Because sometimes the doctor also give the long duration medicine.
No.
Okay.
Just guess why people have this image of homeopathy. Tikva, what do you think?
Well, since we don't face that problem in where we live, people who use a homeopath use a homeopath. And they know that people who use a homeopath know that they're going to get faster, better, quicker results. And let's say if somebody has a flu and they see a homeopath, they know they're going to get well way faster than if they just, stay in bed and drink tea. They know this, but that's, where I live. It's totally different. The concept of things being slow only is only part of, like, for example, if somebody has like a heart disease problem, that's going to take time to cure. But at the same time, people know that allopathy has no cure whatsoever. So, they have to weigh that choice. Do they want to have, painful treatments or side effects or different things like that? So I'm living on a totally different plane of expectations with the public than you are. So this is not really, I'm just here. I mean,
Okay.
the homeopath, that is in Israel or America or Canada, they know the person
Let's
that
begin.
they can cure their thyroid disorder. They can actually cure it. They know they're going to the homeopath to get it cured. Now that might take a year, but that's different than a lifetime of medicine. And it's different than having somebody's going and having radiation therapy to destroy their thyroid. So people are just making different health choices.
Yeah. So let's begin what actually homeopathy teaches us. What actually Hahnemann said about this. He clearly mentioned about acute disease and chronic diseases. Hello?
Hello. Ji sir.
Ah. He clearly mentioned about acute diseases and chronic diseases. And if you consider when any person is sick, out of all his span or lifespan, you can say, uh, about 60 to 70% of time he is suffering with the acute form. And what is this acute? What
And
homeopathy says about acute disease?
a lot of
Sudden
acute,
onset.
Huh?
Sudden onset and
Okay.
relieve himself. Sometimes we need the medicines. Otherwise, the second condition is a death, Dr.
Okay.
Hahnemann.
Okay. Do you agree that 60 to 70% of time the person is sick from acute?
Most of the time, I agree. Ki people is the suffering.
See,
Even the
chronic disease begins very early and it goes whole
long.
length of his life. And often this person will not come for the chronic, but he will come to the doctor with the acute.
yeah, and I get the total opposite in my practice. I am way more likely to get somebody to come to me with their chronic than their acute, but most acutes are simply a flare up of the chronic disease.
Exactly. Not every time we will have, if you look at classification of acute diseases, we have epidemics, pandemics, sporadics, and individual type, right? And of these epidemics, how often we have epidemics? Yes, on locality base, you will have epidemics every year. Certain types of, like influenza, huh?
Yeah,
But not in very vast way, right? And
right.
still we are treating this acute with uh, the symptom totality wise. And then the other form we are having, which is usually there, individual and individual type, we will have like what Tikwa said, a flaring of chronic disease from exciting causes. Hello, are
Yes,
you
yes,
getting?
yes, sir. Means the asthma is the chronic disease. When the some exciting cause occurs, like in the Diwali or in the season, then the again is the acute condition. Is
Mhm.
this is a means this is a just example. There are so many.
Yeah, so
It's classified as an individual disease. because it's a flare up.
And individual disease will always have exciting cause in the background. Flaring up of acute phase, which is of chronic type, and it will have exciting cause. And what Hahnemann says about exciting cause?
Environment.
No, no, no. What importance it has? Okay.
Means the Latin Sora is activated in
No, no. When we are talking about acute, we are talking about these acute diseases where people actually suffer. They will have disturbed their lifestyle. They will have disturbed their routines. And this is only what you call phase of these diseases where people want very fast results. So, do you think homeopathy will do its work? Tikwa?
Well, yes, I think so, because when people come down with a sore throat, that's an acute flare up of their chronic state, we can subdue that really fast. And but then for best results, we bring the person back in and start treating them for their underlying chronic.
Yeah. In acute, we will have result very fast, very fast. And even it is faster than what the modern medicine has. And if you look at what people, what diseases they are treating, they will treat only acute diseases. They cannot cure a chronic one. They will give only symptomatic medicine for the only troublesome symptoms in which are in the acute form. And we homeopath, not me, but we homeopath usually start propagating or having publicity like this. In homeopathy, we treat chronic diseases, where allopathy will not cure, we cure, and they will make impression that we treat the chronic one.
But when somebody does slam their finger in the door, we can get that person well so fast. You know, you can give somebody a dose of hypericum and they can be up and about living their lives like normal in an hour, as opposed to having their hand stuck with an ice jar, you know, taking 800 milligrams of Motrin every 3 hours for the next 3 days. I mean, it's like night and day. That's a true acute because that's an injury. But anyway, I mean, homeopathy works very, very fast. Somebody has a sore throat, give them some belladonna, and they can be up and about very, very fast. As you know, but a course of
We
antibiotics,
have
all these different things takes a long time.
we have suppose we have a case of renal colic. Huh? And the person comes in the clinic with acute pain in the in the loin. Okay. And what analysis we will do? Yes, we will take the symptoms. And what will you check?
Lion region, tenderness
Okay.
on
Gunjan,
a urine, about urine.
you have a case of acute renal colic.
Hmm.
Patient with renal colic, it's confirmed that he has some renal stone somewhere in the ureter or anywhere. Okay. And now he is in acute pain, and what we will do?
We will take the symptoms,
Okay,
whatever symptoms are coming, we will take that symptoms. And on the basis of totality, we will prescribe the medicine.
right. And what will you look
We
for?
will, what is the presenting symptom patient is presenting?
Yeah, I got it. But what will we looking for more in the case? Which will
Exciting cause.
guide us? Exciting cause, exactly. And what will be the exciting cause?
Means
See, there is change. There is change in the body, and that's why this pain has been aggravated. So, what will be the possible causes?
exertion, lack of water,
Lack of water
Mhm.
or any stress.
Okay. If you look pathological, if you look pathological, uh, stone is in the ureter. Ureter is tube. It is tube which have circular fibers. Uh, and there is stone inside this tube. When this hard material gives friction on the internal lumen of this tube, natural response of the body, it will hold this tube like this. It will clutch that stone. Because these circular fibers, when they contract, they will just become narrow. Tube will become narrow. And there is something inside. When this contraction of circular fibers, it will hold this stone very hard. Okay, one is this cause, and other, the location of kidney is at the back. You will have intestine in the front, and if something will be pushing this kidney back, pressure from outside and pressure from inside. These are two factors you need to look at. Pressure from outside, there is intestine, there are other organs. Okay. Suppose, for example, you have this patient with excessive bloating of abdomen. He had constipation and he has or indigestion and he has excessive bloating. That will push the kidney back. That will push that stone also, and in turn, it will start giving pain. Both these conditions, we will have different remedies. Both these conditions. One is a from friction of stones on the internal lumen of the tube, and there will be spasm in the urethra. Sorry, ureter. And type of pain, there will be similar type of pain in the both condition. So differentiating factor will be there. What is exciting cause? What is cause that gives rise to the pain? In the first case, if you prescribe those remedies which will relieve this spasm, for example, which remedies? Gunjan,
No idea. Sir. No.
belladonna. Belladonna will give very fast results in such conditions where there is spasm from the friction. It will release the spasm of ureter. And if there is indigestion or a blotting of abdomen, there are lot of remedies we can say. But from what remedy I got result was Nux vomica and nitrum sulph. Nitrum sulph, when there is you will have a lot of symptoms like tongue conditions, indigestion, chronicness of these indigestion things, and Nux vomica little bit acute form. So if you have how remedy will change from causes. If you look at these causes, see in disease condition on symptomatology, we don't have very long time in the acute case. You cannot take the whole case, whole history for in this acute form. Because patient is in emergency and you have to work really fast. Therefore, do you agree that acute case taking is different from chronic one?
Well, yeah, it is because, well, you really have to gauge, the situation. I mean, sometimes you can give really good relief with the chronic medicine that's needed in an acute situation like that by using the totality of the whole thing. Because sometimes you can just see it. Like sometimes you can just see what the whole bigger picture is. Sometimes we
Yeah. You have to look at the bigger picture, but you don't have time.
sometimes you can
You
find that big picture in 5 minutes.
exactly that
Have 5 minutes.
you need this insight.
Right. If you don't have 5 minutes, you're better off calling an ambulance.
Yeah. So, in my opinion, the image which the public have, the people have about homeopathy, we are responsible for that image because we don't understand the disease type, what we are treating. And unless we don't understand disease, it is even Hahnemann also said, when treating chronic disease, you will see that any remedy you will give, it will suppose it will what to say? It will take time like 20 days, 30 days, or 40 days, or 50 days, or 60 days, or say 100 days with a dose. And that's why he said that you have to repeat the remedy to shorten the duration. And he said, if the disease condition is 20 years old, and if this you are curing or this patient in 1 year period, it is not too long. If the duration of disease state is 40 years old, and if it's taking 2 years to treat, it's not too long. So duration of disease condition actually matters. Acute condition is very short. Patients come to doctor very quickly. And if you give a right remedy with right repetition of doses, you will surely have a very fast results, even faster than what the other methods or pathies use. Even injections will take 20 to 30 minutes to have action. But we will have in a seconds. ठीक हुआ? Okay, she is here.
Hello. Hello.
Hello?
Yeah. Means it depend on the conditions of the acute and chronic
Duration of disease state.
If short period, then we get
Ah.
the result is too frequent, fast.
Within seconds, you will see the results. Within seconds. Yeah, any condition, even in the acute flaring of condition or yes, totality of symptom. Huh? If you give right remedy, that acute phase will just go down within seconds. But we homeopath don't have confidence in us, and we say, okay, we will start medicine and we will see it will take some time. Come after 7 days, come after 15 days. And even the patient coming and saying, Dr. Saab, अभी तक तो कुछ नहीं हुआ है, थोड़ा टाइम लेती है होम्योपैथी हो जाएगा. Like this happens.
Yes, agree.
And then patient will also, okay, I will tolerate for 15 days. Why the patient or any person or that person should suffer? And homeopathy, Hahnemann intended was this cure process should be fast. It should be gentle. Patient should free from sickness or sufferings as quick as possible. He made homeopathy for this purpose. If we are not following these rules, we are responsible for whatever image we are having in the public. Gunjan, do you agree?
Yes.
Is this happening?
No, but nowadays when we counsel our patient correctly, so they are like when they are getting the result fast, so this myth is breaking.
Yeah, it is breaking, but what I am, why we are having this session, that people have image about homeopathy. Lot of people will not come to homeopathy. They will say, okay, homeopathy is slow and we cannot take so long medicine. Why we don't say that your symptom will go down very quickly? Even you have to take medicine infrequently if needed. But we have to give this person medicine every 15 days or every month for years. And what we give? We give nothing.
Yeah.
A placebo for years. And some homeopath will start just changing remedies and they will give remedy. They will see some minor symptom and they will give. What do you
This
say?
new
Each and
method,
every.
new
Hmm?
this new system is working, right? Now the people won't take that much medicine for long duration. So homeopath also are changing.
Very few homeopaths are changing.
Even I am also practicing in that way only. I just explain the people ki whenever you will have some acute attack, you come back. If I'm treating some chronic cases, then only I give medicine for longer duration.
But still, anyone has told you don't need medicine if there are no symptoms. But if you have symptoms, then only you have to take that dose medicine.
Okay.
Means no symptoms, no medicine. Only give the placebo.
You don't have to give the placebo also.
Okay.
Take- Whatever remedy you are giving, either you are giving complementary, either you are giving constitutional, either you are giving antidote or whether any remedy. Follows well remedy, but you have to select or pick that remedy on totality base. Your antidote has to choose from totality. What symptom you have to antidote. There is no universal antidote as such. It will not function in each and every case.
Means the nux vomica and coffee is not the universal antidote.
They are
People are saying,
universal, but they will not work in each and every case.
They're really
okay.
not, and they really aren't. I mean, once you have a well-selected medicine that's active in a person, or even a poorly selected medicine, it can be really hard to move that medicine. You have to go with the symptoms produced in order to shift it.
If you have aggravation and you have to antidote that aggravation, only those symptoms which covers in that remedy which is antidote for particular remedy. Because the person was sensitive for those symptoms, then only that antidote will work, otherwise it will not work in your universal.
We
And
know
you don't.
we know that Nux vomica is not a universal antidote by the mere fact that Hahnemann says to give it monthly for women who have menstrual period problems, irregardless of their ongoing chronic treatment. Therefore, we know it's not a universal antidote. As he says, you're going to treat the chronic, but you're going to give this intercurrent of Nux vomica. If it was a universal antidote, we'd be constantly messing up the case.
Right.
But then again, occasionally we will find a medicine that is disturbed by, let's say, coffee. And if somebody takes coffee, not even just, drinking coffee, but coffee in potency, that it can disrupt the case if it is a specific antidote for that medicine. Otherwise, we can tell people to go ahead and enjoy your coffee within moderation. But there are a couple of medicines that really don't do well on coffee, like phosphorus and causticum. But other than that, a lot of people, unless they really overdo it, which can also be really overdone with, let's say, cigarettes or other drugs. But, a
So,
really replaced medicine.
I just
will
want
support.
to ask one question. The people get addicted to tobacco and gutkhas or alcohol. So if we need to remove that habit, so can we do that? We withhold, like we ask the person to don't take tobacco, and whatever symptoms are produced with after withdrawal of that tobacco, we need to select a medicine which is similar for that situation, you can say, and we select the medicine and it will remove the habit of tobacco.
It can, if people are willing. The problem is, are people willing?
Yes.
Medicine will not do anything beside the will of the person. You
Yeah,
cannot
but if
stop,
he is willing, then yeah, sometimes
then
the
he
people are
don't
willing,
need
but they can't.
medicine. Then if he is willing, he don't need medicine.
No,
Because
but for
see,
example, if you have somebody who's taking sedatives, and if they don't take their sedatives and you're trying to decrease their quantity of sedatives that they've been given, and if their symptoms are of Nux while you're trying to taper down the dose, Nux will help taper down that dose so that people can stop taking their sedatives. Or Nux can help people who drink too much alcohol.
right.
So yeah,
Right.
there's a lot of different ways
If
to
you
negotiate symptoms produced by trying to modify the lifestyle.
if you look at this habit of addiction, there is dependency. If you remember, we learned in some subject, I don't remember. It's been long, more than 30 years now. I don't remember in which subject, but there is physiological dependency and psychological dependency. Psychological dependency is that dependency, like somebody is having uh, tobacco, or somebody is having coffee drinking or tea drinking habit, and he at 7 o'clock he drinks coffee every day at 7 o'clock, and if he doesn't get, there will be some discomfort,
Yes,
but
I am
it is
saying that
manageable. It is
no,
manageable.
sometimes it is not manageable.
No, it is manageable. Because it is psychological dependency. He is psychological dependent on that. But when there is a physiological dependency, his body will not function unless and until it will have that drug, like sedatives, or any, what do you call that, cocaine, or like that drug, like that LSD. Huh?
Nobody takes enough LSD to have that problem.
No. If somebody is having addiction and if he is, we
Nobody
are,
has LSD addiction though. It's not like people who drink coffee or smoke cigarettes. LSD is like a hardcore party drug. It's not something people use on a daily basis. So people don't have withdrawal from it. I mean, they can go absolutely crazy while on a bad trip and you could treat that. But nobody has dependence on LSD. It just doesn't exist.
or
Get
Afim or
concrete things that people actually struggle with. You could talk about pornography addiction. Now that's something that's a problem for people. How to go about helping people with
that's
that.
not what you call a physiological dependency. It's also psychological dependency. So what I mean to say was that in psychological dependency, his body will function accordingly with the drugs. If he is not taking those drugs, then his body will start giving you symptoms, a strong withdrawal symptoms. And that will need treatment. But somebody who is having a habit of drinking coffee, and if he doesn't get coffee till 12 o'clock or whole day, how we can treat him?
It is a psychological problem. So by the
Yeah, it is psychological problem. But after sometimes his body will start adjusting. Alcohol. Alcohol is also will give very strong withdrawal symptoms.
But if somebody drinks, a glass of wine once a month at a social event is totally different than somebody who needs to have their, half a bottle of whiskey every evening. These are totally different events.
We have
One needs
people,
treatment and the other doesn't.
they wash their mouth early in the morning with the whiskey and they will whole day will go. We have such people. They are always in that sedition.
Yes, we
Intoxication,
have.
you can say.
Yes, we have like that people. So, how to treat these people? How to remove their addiction? That's the question. This is out of track question actually. We are going out of track.
It's really difficult actually because that person, I don't know. Tika, what will say?
Well, I just recommended to somebody to try putting some nooks hidden into somebody's beverage to see if that was going to help alcohol cravings and for them to do it.
But how
if we
often,
were
ma'am?
safe.
How often?
I just made the
No,
suggestion last
but
week.
for such people, nux is something different. I think like nitric acid or sulfuric acid could be better.
I think it's Galverdin has a very, very interesting book on the treatment of alcoholism.
Hmm.
Who? Which book, ma'am?
I think it's Galverdin. I have the book somewhere in a PDF. I can flip that into the, it's got some
Okay,
interesting.
But
you
we
send it
have
in
to
the group.
we have to look at the picture. We have to how long he's been taking, how many hours he is in that intoxicate condition. But such people are they are like 24/7. 24/7. I have never seen such people in the normal state any time of the day. So it is really difficult. But
In mild cases, mild to moderate cases, it is possible. But in severe cases, I won't think it is that possible.
mhm. Somebody is having okay once at small in the evening. Then if you want to live, then he can.
Yeah, for example, my aunt and uncle, every single day of their adult lives, they had a gin and tonic at 5 p.m. My aunt died at age 95 recently, and my uncle is 97. He had his first heart attack a year ago, and they have lived perfectly nice, lovely, happy lives to a ripe old age. So it isn't necessarily a problem. It's like how in Italy people drink wine with dinner. It's not necessarily a problem. It's
Yeah.
only when people have a problem that it's a problem.
Okay. Okay, that is also one point. Okay. Thank
So
you, ma'am.
Okay.
Thank
culturally, for people who are, Muslim or let's say Hindu, maybe culturally it's bad if they were to have some alcohol. That's also a different problem than them having a dependence issue. So
Okay.
there's a lot to think about.
We will. Shall we stop here?
Yeah, we can stop. On Thursday, we will meet again.
Yeah, but B'Ezrat Hashem will do aphorism. What is it, 42?
Yes,
think.
we'll continue with 42.
Yep, God willing.
Okay.
Sounds good.
Okay.
Thank you for coming.
You have to close the recording first.